everyone, I'm Dr. Jennifer Sandoval, and I'm a licensed clinical psychologist, and I'm here in my psychotherapy practice in Del Mar, California. And right now I want to talk to you a little bit about my couple therapy specialty and my sex therapy specialty. So in my private practice, I do couple therapy and I do sex therapy. And most of the time, you can't really tell the difference from one or the other. Most people don't understand that if you do couple therapy, sex therapy usually is a part of that. But the couples that I see don't always have sexual issues. Some of the couples that come in and see me are having issues around conflicts. They don't know how to fight, or they're fighting too often. Usually there's a lot of anxiety and a lot of anger, and the partners in the couple have a difficult time managing their emotion. And that's what I do. I help each person learn how to stand up for themselves, but also be able to do it in a way that's respectful and worthy of respect, and in a way that sort of helps them manage their emotions so that their partner can really hear what they have to say. When I do sex therapy, people always ask me, well, what is sex therapy exactly? And sometimes I forget that people don't really understand what that is. And really, sex therapy is basically couple therapy, or it can be in an individual therapy setting also. But it's when you're dealing with a sexual issue. And when I'm working with a couple and there's a sexual issue, basically the issue can be anything from sexual desire issues, so inhibited sexual desire, where one or both partners has either low sexual desire or no sexual desire at all. I work with men who have erectile dysfunction, or they have premature ejaculation issues, rapid ejaculation issues. And sometimes women come in with vaginal pain disorders. So during intercourse or foreplay, they're experiencing some kind of pain. And that can be caused by a lot of different things. But I think a really important thing that I always want my clients to know when we're talking about a sexual issue, and this is true for a lot of other things that I work with in my practice, but it's very important to rule out a general medical condition or even a medication that might be causing a sexual difficulty. So one of the first things I do is ask my clients to be evaluated by either their urologist or their gynecologist or their general practitioner. Usually I recommend a specialist, a doctor who specializes in sexual medicine. And if my clients don't have anyone to go to, I have people that I can refer them to. So it's always important to rule that out. But then usually what we end up dealing with are issues in the relationship, and also issues within the individual that the individual might be struggling with that's impacting their sexual functioning. Oftentimes what it comes down to is usually both partners are dealing with having difficulty managing their emotions. A lot of times when there's like performance issues or there's some sort of sexual issue, there's the secondary anxiety that starts to develop, and then that anxiety really wreaks havoc on the sexual functioning and the sexual relationship. So learning how to manage your emotions in the bedroom and also outside of the bedroom definitely helps a couple when it comes to sexual performance or dealing with their sexual difficulties. And it's also true if I'm working with an individual who has a sexual difficulty. The other thing that I find almost all the time are issues around selfhood. And what I mean by that is, one, usually both people in the relationship are dealing with issues around identity. Are they happy with who they are? Oftentimes they lack self-confidence. they don't know how to manage their emotional world. They kind of blame their partner for what's going on with them emotionally or what's going on with them sexually. So we work on, again, a lot of emotional management. We work on strengthening sense of self, being able to manage what it's like to be sort of close and connected, but also being able to be independent and be autonomous, and really balancing both of those things. Balancing your desire to be close and have intimacy, and balancing your desire to be an individual and to be autonomous. And a lot of times for the couples that I see, there's something out of balance there. And so I help them, get back to that balance and strengthen selfhood. Another thing I see oftentimes is, couples come in saying that they want more intimacy. And then when we really start talking about it, what they want is their partner to sort of soothe them and take care of them, and then they'll feel close. And, real adult intimacy in a long-term committed relationship doesn't involve a lot of soothing from the other partner. It doesn't involve a lot of caretaking. What it involves is a person being able to understand who they are and know what they value and stand up for themselves, and really be able to get up close with their partner and tell their partner what they want, in a relationship, what they want emotionally, and what they want sexually, and to not necessarily feel threatened by that. So issues around selfhood end up really having an impact on sexual functioning. And I think I'll work with individuals who have sexual difficulties, especially if they're not in a relationship, so there isn't really a couple to work with. But when I have the opportunity, I think it's always best to work with both partners in the room. If they're in a relationship and there's a